I'm Grady Collane in the CapeCod.com News Center, and welcome to Sunday Journal. I'm joined today by a special guest who's going to join us for a conversation about substance use and some of the challenges that people are facing. Do you mind introducing yourself for our listeners?
Oh, it's my pleasure. Thanks for having me. My name's Wright, and I am the Community Outreach Manager for Brightview Health in Hyannis.
Awesome. Thank you so much for having this conversation with me today in the studio.
It's my pleasure. Yeah, it's great to be here with you.
So recently, Brightview had recognized the town of Dennis, is my understanding, for its assistance its initiatives providing transportation for those who are facing substance use issues, and that is an accolade worth having, certainly. And I just wanted to ask a little bit more about what it is you guys do, essentially, and then why is that an accolade basically worth celebrating? Do you mind telling us a little bit more about yourselves and the organization first?
Yeah, absolutely. So we provide what we call comprehensive outpatient substance use disorder services. So we fulfill a couple of different roles. One is when someone is transitioning out of an inpatient facility, it can be detox or a residential treatment center, something like that. We will take over in their next line of care, make sure that they're continuing to get their therapy, their medication, etc. And then on the other side, there's a whole group of people that are struggling, but they're never going to go to detox. It's just for a plethora of different reasons. One, they have jobs, they have families, they have lives that they just can't disrupt to go into 14 days or 30 days of treatment. Also, they're reluctant to go to treatment for a number of different reasons. So we can help fill those holes as well and get them access to really good evidence-based treatment without it disrupting their lives as much. So
that is awesome. I mean, it's certainly easy to kind of think about like, oh, well, this is obviously a major problem in their lives, but we're humans trying to deal with everything else in our lives too. Is that a very significant a breaking point? Is those moments where you're maybe transitioning from one thing to the other? Do you tend to lose some people in that?
You definitely do. Number of reasons for it. A lot of people think that going to detox is going to be the end all and be all. They're gone for 7 to 10 days and they've gotten clean and now they're back in their same environments, same people, all the same triggers, and they never really got any kind of substantial treatment. They just were able to withdraw from their substances in a safe environment. So it is really vital for people to continue in some form of treatment. Secondly, you'll have a lot of people that may be getting out of jail. They may have been coming out of being incarcerated for a length of time. And Massachusetts is really good about getting people access to treatment while they are incarcerated. But it is a very dangerous and critical time for them to continue receiving the medication that they need very quickly from getting out of being incarcerated, because obviously their defenses are down. Depending on how long they've been in, the drug supply has changed dramatically, and the overdose rate is very, very high for those just being released from being incarcerated, because they go back and they think that they can kind of pick up where they left off, and unfortunately they can't. So that's a really vital group of people to meet with to make sure that they can transition properly to good outpatient care. We also get a lot of people from the emergency room that, again, they're offered usually in emergency rooms. There are navigators that will help them find services. It's amazing how many people are really very reluctant to get help, even though they're in an emergency room because of their substance use, yet they will refuse help. But sometimes you can give them what looks like an easier path for them to get some help. And not everyone needs full detox. Sometimes outpatient is a very appropriate way for them to manage their substance use.
Just because we are radio, people could be listening anywhere in any circumstance. It's always good to kind of ask, for people who might be needing some assistance right now. Can you just give us a quick, where can people go to learn more? Do you have a website or anything?
Sure, we do. You can go to brightviewhealth.com. And it lists, it allows you to very easily schedule an appointment for yourself right online. And there's also a call center that you can call. And we do not have any wait lists. That is one of the core tenets of our service, because when people are ready to seek treatment, they need to be able to get in right away. It's a very big issue. If anybody has ever been struggling and looking to find a bed somewhere, you can have wait lists 2, 3, 4 weeks, and leaving that gap of time can quite literally be deadly for somebody. So we can get people in the same day. They can actually walk in from the street and get services. If they are in before 3 o'clock in the afternoon, they will leave with a treatment plan in place, and they will have medication to help manage their symptoms.
All right, awesome. Now, the jumping off point for starting to have this conversation, why we wanted to have you in the studio today, was talking more about that transportation accolade that's being provided for Dennis in its efforts to kind of help people reach their destinations. Is that more to do with maybe people who they just don't have a car, they just don't have financially the ability to afford vehicle transportation? Is it more the people just maybe getting out of incarceration and don't even have a license anymore? Can you explain more about that?
Both of those, absolutely. It is sometimes the substance use is way down on their list of things that they need to handle. Exactly. They don't have a car. They may not be working right now. It's very difficult if you've lost your license or just haven't gotten it renewed in a timely manner, or you have some outstanding ticket from 2016. It costs a lot of money for people to get that. Those are some of the services that we'll help people with, connecting them to community resources, because that is often one of the biggest things, is getting somebody with a valid photo ID, whether it's a license or just an ID, because that prevents them from getting a job, all of these things. So transportation is huge. On the Cape, as we know, things are quite spread out. Public transportation is okay, but it's not going to really reach everybody. So Dennis has been able to offer a grant to us from their opioid remediation funds. And they've done it with other partners as well in the community. They've done it with Duffy Health. They've done it with the AIDS Resource Center as well. Yarmouth, CTC, they've tried to spread out those resources to allow people to get to their treatment that they need. And it is amazing. It is possibly the biggest barrier that people face.
Mm-hmm. It is unfortunate to kind of hear that just the very geography of the Cape can sometimes be its own obstacle to kind of overcome, especially if you're already kind of maybe dealing with some challenges down a peg because of the other stuff going on in your life. But that is interesting to see that there's the help out there. Do you like the idea of would you like to see more towns being able to kind of jump on this and provide a little bit more assistance in transportation as well?
Absolutely. I participate in a couple of different committees in Barnstable County, and our goal is to bring to each of the towns to try to get them to be willing to consolidate those funds a little bit more, because Dennis, as wonderful as it is, it's to be used only for Dennis residents. So that ends up being limiting if you happen to live in Yarmouth, for example. So trying to create a little bit bigger slice of pie with these funds, and also to our goal is to remove as many barriers as possible. And your town shouldn't preclude you necessarily from being able to get help to get where you need to go. So that's something that we're talking with. There's a committee called the RSAC committee that is a bunch of different community organizations, and we're really kind of pushing for to try to get a little bit more cooperation. Every town understandably wants to manage those remediation funds, and different towns have different buckets that they're getting from the state. So they have their own restrictions of how they can use the funds, but we're hoping to try to convince more towns to kind of collaborate a little bit more on some of those things.
Yeah, I believe Barnstable County, the county-wide has a substance use program as well. Are they involved in some way? Do they have a transportation bucket, or would you like to see them kind of be involved in this process?
Yeah, absolutely. I think that they're well aware that it's an issue and want to find a good, viable solution. It's definitely top of their radar, and it's just bureaucracy and things like that. For us, it's like we want to snap our fingers and here's pool of money and go order the Lyft rides, that kind of thing. But we're trying to be thoughtful in our approach. And Lyft is very expensive. And again, some of these distances, if somebody's coming from Orleans because there aren't good resources there, that's a really long ride. The other thing that's also important is that people shouldn't have to have their whole day taken up with getting to an appointment.
Well, it's a day of wage if they have a job currently.
Exactly, and they can't just always drop everything to get to where they need to go. So that's we try to be cognizant of this is not their only issue that they're dealing with in their lives. So the more resources, Town Taxi has been a really good partner with different organizations, and we also utilize PT1 a lot, which is Mass Health's assistance with getting transportation. So it's not something getting funds from the different towns is not something that will be used for somebody for every single visit necessarily. It's more for those first couple of visits to get them established and make sure that we get their health insurance established if they don't have that, and then can get them on what's called a PT1 if they have Mass Health, which is, I would say, a really good number of our patients utilize PT1 services. And we organize that for them. There's an app through the state that we can just literally say, okay, Grady, they'll be there at 9 a.m. to get you. So.
And that is awesome.
Yeah,
good to hear.
Really it's fantastic.
I imagine. I also want to ask a little bit more about childcare as well. But I imagine that digital has kind of made it a lot easier to kind of handle a lot of the inflow that comes with the traffic of people that need assistance. Definitely.
So we have a very robust telehealth availability for people. Again, for all these reasons, that people can't get where they need to go oftentimes, and again, to not be as disruptive. And we'll have people doing their calls, in their car on their break at lunch, things like that, and whatever works.
Yeah, I think we've ironically hit a future where it's easier to afford a cell phone with a camera built in than it is a car. So.
That's very true. And we'll help get them resources to get those cell phones. There are some good organizations that will help with providing the digital equipment that they need to be able to do the telehealth appointments, which is great.
Not to put you in the hot seat or anything if you don't have a program yet for this, but just with the whole transportation stuff and other things, like people have daily jobs or the responsibilities, like is childcare a major obstacle as well? Like maybe parents or guardians are just like, I can't really leave my kid for this long, even though this is a major issue for me. Like has that been a conversation? Can you elaborate more?
It has been a conversation. We do not provide childcare specifically. In Hyannis, we have a really great waiting room, and we have coloring books, we have snacks, we have juice boxes, we have things like that to help keep kids occupied while their parents are in, if necessary. It's not as big of an issue, but it definitely, we do have some families that they bring their kids along, which is great, but we don't have a specific, child care drop off or something like that. So.
Sure. Well, that is good to hear as well, specifically as we hear more conversations about State Senator Susan Moran is always highlighting, especially the issue with childcare and some of the ways that's preventing the community from being a full sustainable economy, let alone just for the people who might be struggling with substance use. So it is very interesting. You mentioned as well, is there like subsidies available from like the state or something? Have you been like hoping the Cape delegation might have eyes on this issue? Do you think that we have the right spotlight necessary to kind of get this solved, or?
I think that there are multiple conversations going on. I think that the funding is there. The desire to do the right things are there. There are obviously going to be differing opinions about how things should be used. There are conversations about how will things be tracked. Are we sure that this is a useful, good use of the money? I think that everything is moving forward nicely. Barnstable recently had a great workshop that had multiple community stakeholders, and including Judge Julian, who runs the recovery court in Barnstable. Their state representatives were there, and a lot of key community providers from all different gamuts, not just substance use, but housing authorities, et cetera. And it was a 3-hour workshop about where should this money be spent. And the biggest takeaways were transportation and assisting people with the basic costs of getting back on their feet, whether that is providing stipends to pay for sober living. There are a lot of good sober homes on the Cape, but it can be really prohibitive when you have nothing to come up with that $200 a week, and you don't have your license, and you can't get a job yet because you're waiting for your ID. All these things. So that is probably the biggest takeaway, is to try to find a good way to help give people literally some cash in hand to get back on their feet.
Mm-hmm. It's very interesting because, as well, there's such a tremendous overlap. We talk about the issues with substance use, of course, but if there's so many tangentially connected things, inherently demographically this impacts a lot of low-income peoples, which means housing is an issue, which means that childcare is an issue, which means that. So it's like a chicken and the egg scenario that we reach.
Yeah, it definitely is. It definitely is. And I think that, again, we're all acutely aware of it, but there is a housing shortage on the Cape, and it is, the cost of living has gone through the roof. Rents have gone through the roof. And it's very challenging there's also very few shelters on the Cape, and they are always full. And then we also have, a crisis with migrant families needing housing as well, and that they've been brought to the Cape, which also puts a strain on resources. And it's amazing the Cape's been so welcoming, but it also takes up space in the shelters oftentimes for local residents, and frankly, shelters are not the best place to be. We have a lot of people that would rather sleep in a tent in the woods. So there's really good outreach. Housing Action Committee will literally go out and meet them in the woods and make sure that they have the things that they need out there. So people try very hard to meet folks where they're at and try to still get them the resources that they need.
Mm-hmm, mm-hmm. Very interesting and good to know there's a lot of tools out there. As we kind of see a little bit more as well about there's the nationwide opioid settlement, and a lot of towns have been allocated a ton of money, and it just kind of depends on how much they've been impacted, unfortunately. Is this like a watershed moment? Have you guys been trying to be hit the iron while it's hot? Are you guys plugged in? What are you feeling about that situation?
We are plugged in. I think that, again, it is challenging to know what all is out there. There are a couple of good organizations. One is PARI, P-A-A-R-I, which is police assisted. I'm going to mess it up, but it's to...
it's a conversational program.
Exactly.
It's out
PARI,
there.
But they are throughout many municipalities in Massachusetts. They have a weekly call that office hours for you to call in and find out how to access remediation funds. So there are places that you can find out more information about how to do it, and a lot of it is presenting to the different local committees, that kind of thing.
Sure, and this is for town officials that might need to learn more.
Exactly. So for town officials or for organizations that may be looking for grant money, whether it's transportation or they want some money for housing or sober homes or, all kinds of different issues.
Do you think is that a major issue? Is that there's people who want to help and they might even be the head of organizations? They're just I just don't know where to get the money, essentially, even if it is out there. Do we need more quick sheets, essentially, of where people can apply?
I think so. I think that there are, since I've been in this position doing outreach, I have found out that there are actually a ton of different resources out there, but you don't know what you don't know. And there are a couple of good places to find out information through the Mass Helpline about where you can get behavioral health care or substance use care, but you don't have as much a centralized place for housing or for food, things like that. There is some of that. Barnstable County has a good resource right on their website that has a lot of local contacts for people that does also include childcare, different things like that. So, but it takes a lot of digging, and a lot of people don't always have the time to go, doing multiple Google searches to find things out. And then how do you then access it, and what's the application process, et cetera. So there's always things that can be done more streamlined. but it's hard.
And I'm sure the omnipresent fear of audit that comes down at the end of all federal dollars and state dollars being handed out for different initiatives as well, trying to make sure you do it right, get the paperwork sorted in the first place.
Yes.
Perhaps it's just my journalism peeking through, but I'm like, wow, very interesting to think of like maybe a one-stop shop kind of website or something that shows all the different buckets to apply for money when it comes to, are you childcare? Are you substance use disorder? Like what's going on and what do you need to apply for? So very interesting. We are about coming up on time, unfortunately, but I just wanted to ask if there's anything else you wanted to highlight for our listeners, talk about more of the resources that are out there for people who might be struggling. We mentioned a little bit off microphone, but you mentioned like a once a month, every Monday, the last Monday. You mind elaborating more on that?
Sure. So the YSAC committee, which is the Yarmouth Substance Abuse Committee, has a drop-in night at the South Yarmouth Library every last Monday of the month from 5 to 7. And that is an excellent place for families to go to find out what resources are available, get connected to services, and just get more information about substance use disorder in general, reduce stigma, and dispel some of those myths that exist out there about, the people that are struggling with it and how to best access treatment.
Mm-hmm. Yeah, I mean, we have a little bit more time, and I would love to dive into one of the final issues that we see is not only the housing, childcare, transportation, but also the cultural issue as well. Do you think that is maybe the hardest thing to overcome? Is just that maybe feeling of failure or whatever else might come along with this issue?
Exactly. It is the only chronic illness that has so much shame associated with it. I don't think that anybody suffering with high blood pressure or diabetes feels an intense sense of shame because they're struggling, nor do they find themselves judged harshly in the emergency room or by doctors or by other family members. There's an incredible amount of shame, and that really does prevent people from seeking treatment, which is too bad. So I encourage families to learn more about substance use disorder. It touches everyone. I don't think you can have a conversation with anyone that doesn't know somebody that is deeply impacted by this issue. So it's incumbent on all of us to learn more that it is a brain disorder, not a moral failing.
All right, awesome. Thank you so much for joining me for this conversation. I appreciate all the information as well as the conversation in general, and hopefully we can have you back in sometime soon.
That'd be great. I really appreciate it. Thanks, Grady.
Yeah, thank you. I'm Grady Collane, and this has been Sunday Journal.